what we have picked up. Of course, has come to we have some interesting picture. You know, both of us we have seen. Look, this patient has come to our clinic, in civic clinic, and all of a sudden, during the examination stethoscope, I saw your fingers. I saw these two fingers were it. So it is the reality. Many patients came suddenly. You see the accessories finger. Whenever we are seeing genital abnormality limbs, we try to get there any cardiac anomaly or not. We want to go for thorough checkup. So these are highlight one pictures of these. So these fingers, accessory finger of this. This was a typical one while examining the patients. This is some orthopedic problem. The trigger finger like this. Patient was unable to hold the straight. I keep it this. Might be some triggering finger or some rheumatoid changes. This was his normal posture, permanent posture. This is a patient's limbs, upper limbs thrombosis, sudden onset. Patient came to us with the complaint of that there is a huge swelling and inflammation, and this upper limb thrombosis was a completely thrombosis in the upper limb. Very interesting. This is our ICUs and our own creation. Look for this. There is a huge ecchymosis. The patients were treated, gone for a streptokinase, and we always used to give instruction: don't give IM after STK. But sometimes even for Raglan or EMA commonly not following that things, but here the complication. Why? After IM injection on acute MI patients, and later on IM injection has been given, and look the picture of the EMA. So these are basically eye-opening for the nursing staffs and those who are giving IM injections. So that's why we keep this picture. Then don't give IM injection after the IV of streptokinase use of that. Here these two gentlemen, family runs in the coronary runs. One is having bypass surgery, one is both brothers from Agra and used to follow up. And this one have gone for the angioplasty balloon and second has gone for the bypass surgery. Both brothers are very happy. Last 10 years they are coming to our hospital for regular. Not it has mother to son. This we have a typical history of very typical history. He was having angina during the bedtime in night. That symptoms brought him to us initially. Huge headache after when you were marriage consummation, and then he came to us, and later on we did the treatment. It was positive, and patient has gone for the angioplasty. That failed, then gone for bypass surgery. His mother is having bypass surgery. So mother and son, brother and brother, father and son, huge number of cases. We are getting interesting cases. These two brothers from Kharagpur. These brothers has come for us. You look. One is which one is that? This one is the elder brother, and second is this. This family. This is a Marfan disease. This is a Marfan, and this brother is a elder brother, and he is having history of the dilated aorta with significant aortic regurgitation. And among Marfan, this is the Marfan family. We have taken the detailed history. 4 or 5 members among one short-heighted male among the brothers was free of Marfan. Rest 3 having Marfan. Even female, her sister was having Marfan. So these 4 family runs from Kharagpur. They all have Marfanoid feature, and Marfan syndrome criteria was fulfilled. Later on, we planned for the aortic root transplantation changes through the prosthetic valves. Non-treatment is long. So this is an interesting case we have seen. These were engineering students admitted last 2 years with VT, and we have treated with Corderon drip and followed by DC shock. And this patient was having, you see, later on this ICD was done by the Dr. Ravi Kishore at RN Tagore, and this is Durgapur Engineering College, is studying at Durgapur Engineering College. we saved his life. He's the son of our accounts staff, and this boy is very happy now completed his course. So he is on ICD, intracardiac defibrillator. He was having 2 episodes of VT. We treated with drugs. 1 episode, first time basically I failed to diagnose. First time when he came, his ECG was normal. I thought it was normal. So we did the echo. And echo was normal, only RV was dilated. I have written RV was dilated, echo was normal, and you come after. Next time when he came, ECG was showing VT. Then we did the MRI heart, and MRI heart was showing ARVC, arrhythmogenic right ventricular, and that was the cause of the VT. And then ICD was implanted by Dr. Ravi Kishore, and till now all right. Last 2 years, 2.5 years, we are doing the follow-up. Sometime interesting case. He fell down in bathroom and look. We thought what happens. He came to us, and later on, absolutely it is a black eye, nothing else. Sometime there are other pictures we missed. This is a very interesting patient with a female cardio. We admitted with recur and unable to this with the basically epistaxis, and the epistaxis Barma is there. Dr. Barma has later on we called he put a Foley's catheter later on, and after Foley's anyhow that bleeding has been stopped. So these are Foley's on this, and later on she became all right and gone further. No. This man is a very interesting case. Probably India's one of the longest surviving patients, Mr. Adhikari from Mandul, and we are doing this since last 36 years. In 1974 he was implanted first pacemaker, and 5 times we have changed this. He is now 87, his RPF. At the age of 50 he was first implanted, and this is the 5th 2 implant we did it here, 2003 and 9, and we are doing the, he is absolutely all right. Look his health. So this is the probably we have met in our association with the longest surviving patients on Indian pacemaker. Probably one of them. I have not got any other data. So 37 years on the pacemaker. This Mr. Adhikari. And this is the youngest pacemaker we are following up. This is the congenital heart of this, and this pacemaker, this young girl, since 7 years we are doing follow-up. And this was basically having congenital heart with VSD, and then VSD was operated in that time, the CHP occurs, and this was put on the pacing. Sometimes horrible to look at which day the pacemaker will come out, but it is all right. This is 100. The patient admitted with 100 years. They are absolutely 100 centuries. That's why we keep it. That still, Thakurma is surviving. For so many long years, we are doing the follow-up. Sometime interesting. These patients, suppose remember in casualty, I have taken the photographs. He came with some party near relatives' home and took them fevers, some medicines, might be sulfa. It was Steven Johnson, and came to casualty. What is there? So you remember this corner bed man? What was happened? It was absolutely Steven Johnson. So very interesting case we used to. This is the young patient, young athlete with adult PCL. We admitted him isolated first day in ICU. Later on we found he was a sportsman, and later on all the rashes have vanished. He was a 100-meter athlete. All of a sudden fell down in fever with the huge rashes all over this. We have later on come to conclusion that it was adult bleeding. This patient was admitted with a huge thrombosis of his one of sister's relatives, and he died later on because of emboli, valve emboli over the valve.